Welcome, everyone, to another episode of Currently Speaking, the podcast of the Current Consulting Group. I'm Bill Current, president and founder of the Current Consulting Group, and I'm joined today by Jo McGuire, executive director of NDASA. Welcome, Jo.
Listen, Bill, thank you so much. It's a pleasure to be here with you and to speak with you on your podcast, and I'm happy to be here.
Well, we are very grateful to have you on this episode. Now, let me say to the audience, thank you for coming in to view this episode. If you'd like to see past episodes of Currently Speaking, they're available on our website at currentconsultinggroup.com. You can also email at info@currentconsultinggroup.com if you'd like any subjects that you want to suggest, anything of that nature. Info@currentconsultinggroup, and we would be happy to entertain any suggestions or ideas that you have for us. Now, today we're going to talk about a subject that is very near and dear to Jo's heart, which is recovery-ready workplaces. But before we do that, Jo, tell our audience what you were doing in Chile last week.
Well, thank you for asking, Bill. So one of our founding members, actually founding board member, Patricio Labatut, and his partner, Eduardo Solis, they had a drug-free workplace congress in Santiago, Chile. It was their second one. The first one was 10 years ago. He never intended to let 10 years go by between the first and the second drug-free workplace congress, but some political turmoil took place down in Chile, and the government was very unsettled for a while, and it just wasn't a safe thing to do for a very long time. So he started planning this one a couple of years ago. I have to tell you, 10 years ago when we went, I think there may have been about 100, 125 people or so in the audience. Probably 90% of the speakers were from the U.S. We might have had one or two, including Patricio and Eduardo, that were local. This time, I'm telling you, there were 400 attendees. 450 were registered, 400 attendees. And the majority of the speakers were from Latin America, all over Latin America. And there were, several of us from the U.S. that came and spoke and supported the messaging and the statistics and whatnot that we bring to the table from proven programs. But one of the things that I want to stress is that there are no regulations in that country for drug testing, none whatsoever. And Patricio's original goal, his initial heart for this, was to see if he could get the ministers of transportation and labor and safety and whatnot to do some mirror regs like we have with US DOT. And, we're a ways from that, I believe, but the work that they have done to help employers understand the need for creating drug-free workplace policies has been phenomenal. And a lot of the speakers were local, my people that are in human resources for mining and energy and construction, and demonstrating the success of their programs. One company showed that from the time they started their drug testing program until now, they've had a 50% increase in revenue because of the just the increased productivity and employee attendance and just all of the things that we talk about, right? All of the benefits that drug testing brings. And of course, I'm sure there's other factors there, but at the same time, it was, for those of us who were there the last time, which included Patrice Kelly, who is, of course, with Current Consulting Group, we were astounded. We felt like we were in a completely different place. It was amazing. And so my part was not only as a co-host and a sponsor, but to really talk about drug use in the U.S. and what the trends are here, and different parts of the world were represented with those statistics. And it's always hard to stand up there and because, Bill, the whole world is looking to the U.S. for solutions. And yet we get up there, and the slide that we have is, 90% of the world's drugs are consumed by the U.S. We have the greatest amounts of illicit drug use in the world. And it's a little heartbreaking to have to be transparent about that. But at the same time, the work that we've done to protect workplaces and the traveling public does tell a success story. So, especially where we were, 50 years ago. So, yeah, so that was a part of it. And then I hosted a roundtable that was focused on recovery friendly workplaces and what second chance policies look like and what some of their companies are doing to try to get people in follow-up testing programs. And it was just an honor and a privilege to be a part of it.
So before we leave this subject, you've had a lot of dealings with Patricio and Eduardo and others in other parts of the world. What's different about how they approached a drug-free workplace program and drug testing compared to the United States?
To be honest with you, I think that it is about relationship building. It really is about, one thing that became really clear is he has personal relationships with every one of these folks. He has invested time. He has sat down with them. There is this long-term caring and nurturing relationship that has taken place because he has worked with them from day one to create policies, and they've learned and grown together. I think sometimes we tend to sort of shortcut this with our clients and just go, the regs require it. Safe and drug-free workplace requires it. Well, do it if you want, don't do it if you don't want. Or, your policy needs to be better and we can tell you what you're doing wrong. This is much more organic at the relationship level. And it's what they've had to do because they haven't had regs to back them up. One of the things I've promoted for many, many years since when I very first got into drug testing, I was working for a company that was a franchisor. And we had a few very small franchises, but part of my job was to go to their location and help them find clients and build their book of business. And Bill, listen, I didn't build the company that I was working for, so I wasn't always entirely sure what I was doing, but I was a student and I went to the franchise, companies, and I did everything that I could figure out how to do. But the one thing I said to them over and over and over again was, you have to earn the opportunity to be their trusted expert. And the only way that you can do that is to care enough to help show them what works and doesn't work personally, one-on-one, and just keep going back and saying, I care about you. I care about your people. How can I be a resource for you today? We're not always in a world that likes to take that kind of time and put that kind of equity in people. We want conversion, right? We want KPIs. We want conversion. We want this happening right now. And I understand that, but drug testing isn't McDonald's. You don't throw up a store and everybody gets in line.
Yeah.
You really have to put the legwork in it, and it is through the relationship development. And they've been patient. They've been in business for, over 20 years, and we're seeing the fruit of that labor 20 years later. I have 10-year snapshot, but they've been at this a very long time.
Yeah. Well, and that's a nice segue into the topic for our discussion today, which is recovery ready, recovery friendly workplaces. And I've heard you speak on this subject many times. Tell us what that is, and then we can kind of launch into some specifics.
Absolutely. Well, there is a movement. There are synonymous terms, recovery ready or recovery friendly, and you'll hear it in different places, and it's the same thing. But there was an initiative that Governor Sununu started in New Hampshire. And I don't know the whole history behind his motivation, but what I do know is that this initiative of Governor Sununu became so successful that it became a model in the US, and other states started going to New Hampshire and saying, tell us what you're doing and how to do it. It got so it grew to a point where these, 2 or 3 women in this little tiny office that was funded by the state of New Hampshire for one initiative in the state budget. They were trying to do outreach to the whole country, and they said, we can't do this. We don't have the money for this. We're happy to share it, but someone else has to take on this, this job. And so Dr. Andrea Barthwell and Kathy Hartnett and a few others that some that actually came from that office, they started a Global Recovery Initiatives Foundation to sort of, and it's a nonprofit, but they sort of wanted to take this model, start a nonprofit over here and say, how can we be a resource out, not just to the States, but, to the globe, thus Global Recovery Initiatives. But ultimately, we have seen some amazing success with large companies, organizations, associations, and whatnot, who are not, it's not just about second chance policies at work when people have drug violations. We are talking about peer support recovery for those who are actively in recovery from addiction in the workplace. So I have to tell you this little story because it really makes all the difference to our industry here. I had heard some of this. I had seen a little bit of it in Colorado. I was asked to talk about recovery perspectives at a conference that I was speaking at. And I started researching and I started finding these toolkits and I figured out where this all went from. I called them up. I asked for a conversation. And the very first responses were like, drug testing really doesn't belong in this conversation. Like, you seem like a nice person, but what are you doing? And no, we don't, we can't get in. Drug testing is predatory. It's abusive. It's, Joe, I mean, it was really, I think they were hoping I would stop calling. And I wouldn't stop calling. I'm going to have this conversation. And so finally, the whole team came to the table, and I think they came to the table just to tell me to stop calling them. And they would probably never admit that, but I really believe that's what happened. So we got on this call, and they said, why do you think drug testing has a place in recovery-friendly workplace? And I said, are you familiar with US DOT drug testing programs? No, they were not. And I said, okay, well, I gave a little brief history. And I said, I think we have a major disconnect here because the return to duty and follow-up process that was written into the DOT drug testing program is the original recovery-friendly workplace in the US that took place 30 years ago. And I think you have missed that key point. And while I understand that, just termination of everyone who has failed a drug test has kind of become the norm in our culture, the intent was to keep people working, get them back to work, see them through recovery, and have them restored to wellness. And I'm sorry the message has gotten lost in the carrying out of the policy, but we need to have a mission to be here to change that and to figure out how to remind people that we've got to take care of one another. And you are never going to fire your way out of addiction. Right? You're not. You cannot solve this problem with all of these drug crises that we have around us by just, taking people's jobs away, putting them on the street and saying, lesson learned, right? Yeah. Get better before you can get into the workforce. All that does is contribute to their problem and their spiral and keep more of the same on top of them. So a lot of this goes back to how we view substance abuse disorder, how we view addiction, understanding the brain and all of those things. There's a lot behind it. But once I brought this message to them, they went, oh, well, we had no idea of this. Let's talk about this further. So we continued the conversation to the point where 9 months later, they actually kicked off the announcement of global recovery initiatives at our annual conference in Hershey, Pennsylvania in 2024, and brought Forrest Marsh to the table. Forrest Marsh, a lot of people know that company on the East Coast, but one of their experts came to the table and what they talked about is what peer support groups look like there. And we're seeing this in a lot of other companies too. I have to go and look at some of the companies that they have, and I'll do that here while we're talking. I'll pull that up for you. But one of the things that is so cool is these companies have peer support led by people in recovery on site at work, and they have meetings at work. They give back to the community. They have active programs that they engage in, and they do things on purpose to be drug free in the workplace. It's very intentional, and alcohol free. And I have to say, that's something that we all go, oh yeah, drug free, but we're very reluctant to say, yeah, we should also be alcohol free. And so we're starting to now see data and statistics come to light that are showing the success of these programs from keeping people at work. And last year I was privileged I'm now part of the Employee Council with Global Recovery, and I was privileged to go to the White House and to kick off the drug-free workplace or recovery-friendly workplace initiative from Washington, D.C. at the White House. And one of the things that was so cool about that is that I think, I want to say, a large percentage of the people at the table that came from major companies around the country, they were the person in recovery. And they were the person running the peer support program. And these are high-level executives. And, they were willing to say, we're just not prepared to lose more employees as a result of addiction and substance use and overdose. And we care enough about our people to change how this is all perceived. So, yes, I am very passionate about it, as you can tell. And I think that the drug and alcohol testing industry is a natural fit because we're the ones that help employers write their policies. Yeah. And, when an employer writes their drug policy, Bill, what are they asking you questions like, hey, Bill, what consequence should I have for this? Or what do we do about this? Or what does this mean? What is this panel of drugs? I'm sure they ask you a lot of questions, right?
Sure.
Because they don't know what any of that stuff means. And they look to us and go, well, what should the consequence be? Should I fire them? What is a SAP? How much does that cost? Do I have to pay for it? Do they pay for it? What does that look like? We're the guideposts. We're laying those stepping stones down before them. And if we're not armed with the proper information that they actually save money keeping employees at work, who they can restore to wellness, we can be doing them a disservice because employee turnover is costly. And you know what? It's not going to be 100% fail-proof. You're going to have people who will abuse that and will have to, be set on a different path. But by and large, these programs are extremely successful and they change lives. And I think that's where we should be.
Yeah, and I think when you think about the investment that a company makes in an employee, hiring them for one thing, and then training them, years of experience, learning how your company works, etc. I saw a report the other day that, and this is probably a generality, but it said that to replace a worker costs about 21% of that individual's annual salary. So if you're talking about somebody who was making $100,000 a year, that's $21,000 to replace that person, as opposed to helping them get better and bringing them back and not losing all of that, valuable experience and training. The other thing I wanted to mention, you talked about the role of drug testing. Jo knows that I'm putting the final touches on a new book about marijuana. And some of the research that we did was on individuals celebrities, let's say, who talk about how their road to addiction began with cigarettes and alcohol and marijuana being the first illicit drug that they used. And then they went on to harder drugs. This is not a comment about marijuana being a gateway drug. But one of the things that many of these celebrities have said publicly is that thanks to, among other things, drug testing and being held accountable through their treatment, they felt a greater, urgency or obligation to stay drug free.
Right.
And I read a book years ago, the autobiography of David Crosby, the former rock and roll star who passed away not too long ago. And he tried for years and years to kick his drug habit. And
Mhm.
and of course he went to prison. And in prison he was, I guess, subject to drug testing, but he was also cut off from his normal dealers and suppliers.
Mhm.
And he made some very, very positive comments about the role that drug testing played in his recovery,
Mhm.
to where he got to the point where he wasn't addicted to those harder drugs.
Mhm.
So I think there's obviously a role there, and you would be, the proper voice to advocate for that and its role in a recovery friendly workplace. Because if possible, we want to retain those workers and not simply cast them off back into society for somebody else to deal with their problems.
Exactly. And again, this really comes down to um, a clearer understanding of what substance use disorder is. And listen, Bill, it took me a while to change my perspective
Yeah.
on this as well. The first time I heard someone say addiction is a disease, I'll be honest with you, based on my upbringing and my core beliefs and just what I had learned in my life, um, I just saw that as an excuse. I really did. Another disease, right? But then in the work that I've done over the last 20 years in my career, I've met some incredible people that I have great respect for. Um, and one of the most influential people in my perspective here is Dr. Christian Thurstone. He's a triple board certified adolescent treatment provider who's also a psychiatrist. He's also an Army reservist who treats addiction amongst our soldiers. He gets sent over to the Middle East to treat addiction there with troops and has an amazing practice in Denver, Colorado. Just a highly respected individual. But I sat through a session of his back around the time Colorado was working on legalization of marijuana, and he showed how once a child or a young person takes on a substance, it just fires up different parts of their brain that were not intended to be fed those drugs at that time, and then their brain starts saying, "I have to have this to survive and function. Otherwise, I don't know how to do these things." And so, um, they really get themselves in a place. And yes, I understand, they consumed the product or the substance, but the brain gets to a point where it tells them, I can't survive without this, I can't live without this, and the side effects are terrible, and they're not equipped with how to deal with that, and they do need intervention. And so I started looking at that, and then the brain change that can take place over long term, and and uh, then meeting other people. A common thread has been, this is not a moral failure; it is a mental health issue. And I want to tell you a story, if I may, that really all of these things were floating around and different things I was taking in, and I was trying to figure out, how do I feel about this? What do I think about this? And I was invited to speak at a pharmacy conference in Phoenix, Arizona. How I got there, I do not know. Not a pharmacist, but they did ask me to come and tell the story of what was happening in Colorado with legalization, and it was a couple of years after we, had gone down this path. So I'm sitting in the audience, and this physician gets up to tell his stories, kind of a keynote speaker, very funny guy, very entertaining. But he starts telling his story of recovery. And he said, I remember the every detail of the room I was sitting in and the burnt orange chair in my mom's living room that had a cigarette burn right here on the armrest. The first time my mom gave me cough syrup with codeine in it. It was like third or fourth grade he was. And he said, I remember sitting in that chair and she put Bugs Bunny on for me. I was sick. She gives me the cough syrup with codeine. And he said, within about 15 minutes, I sat back and in my head, I said, this is how I want to feel for the rest of my life. And he said it was the best feeling. It was my first high, and it was the best high I ever had. And I chased it for the rest of my life. And he had a story, I mean, multiple DUIs. He lost his medical license. I mean, his life just went all to pieces until he found recovery and healing. But he said, I tell you that story to tell you that not all of you had that feeling the first time you had an altering substance. And I remember the first time I had Vicodin after dental work, and I just kept saying, I never want to feel this way again. I don't want to take that. I will deal with the pain. How many Tylenol can I take? Because I don't
Yeah.
want that. That told me that there's two different kinds of brains, and I don't have the one that is prone to addiction. My body doesn't like it. But I have a son who his brain was the other way. And he felt it, he experienced it differently, and it really did change my perspective. So let's move this into the workplace. We take a step back and we look at individuals who their brain is different and they have a substance use disorder. They need treatment, they need intervention, they need recovery for the rest of their life.
Yeah.
Lifetime recovery and lifetime support in recovery. That's a big commitment to those of us out here who are like, why should I support these people for a lifetime? What business is it of mine? I guess it comes down to, do we care about our humanity or do we not? And our fellow man, and do we want to be stronger as a community, as a workplace, as a group of fellow citizens? We can keep fighting that and we can keep disregarding that and throwing people away. It costs all of us dearly.
Yeah.
But what we've been doing hasn't worked. We have to do something different.
Yeah. So, Jo, how can an employer get started and how can NDASA help?
Well, again, we are now, we are an official recovery-friendly workplace. We have the seal on our website. We went through Global Recovery Initiatives and the Recovery Friendly Institute. There's an application that can be filled out, and I can help guide folks there. You fill out an application and you basically get scored on points. Like, do you have a policy? Do you include mental health assistance? You get just a variety of points for things that you do. For instance, when you have a company party, do you have an alcohol-free option? Things like that. And it's for small companies and large companies, and then you're interviewed by the team, and and we have started kind of small right now. We literally vet out every single applicant to make sure that they're committed to the program, and we've brought in some amazing companies into this program that we're very proud of. For instance, United Auto Workers, and there's some really amazing. The Flight Attendants Association of the U.S. I believe they're if they're not already on the list, they're in process. So I'd be happy to help. But globalrecoveryinitiatives.org is the website, and I'm happy to help anybody who would like to kind of get an official seal, but also it is as simple as good practice, right? Yeah. So those second chance policies with this SAP, the substance abuse professional, with an EAP provider, we have resources for all of those things that are affordable through our members. And we're happy to serve and assist in any way that we can.
Excellent. NDASA.com. You can get a hold of Jo. How can people get a hold of you?
Jo McGuire at NDASA.com, and that's JOMCGUIRE at NDASA.com.
Excellent. Thank you, Jo, very much. I know that this is real. I mean, we just see ourselves going in this direction more and more, and we have to. the whole legalization of marijuana is playing into this in terms of how employers are addressing substance abuse in the workplace and what they do with employees who maybe have a substance problem, maybe they have a substance use disorder, whatever it may be. But going forward, I think this is really will continue to be a growing part of how we as an industry in the drug testing side of the world help employers, but also how employers help their employees.
Thank you, Bill. It's been an honor to talk to you about this. I know I've been super chatty, but there's just so much to
No,
say about it, and I do get very excited. So thank you for the opportunity.
absolutely, my pleasure. And you weren't too chatty. It was all very, very interesting. So thank you. Thank you, everybody, for joining us for this edition of Currently Speaking. If you'd like to learn more about Currently Speaking, go to currentconsultinggroup.com. You can find an archive of all of our past episodes. And with that, we'll wish you a happy day. Thank you.
Thank you.